Hi, good evening, everyone, and welcome to tonight's UP Community Health Town Hall Series. Our topic tonight will focus on mental health and well-being. We have a panel of experts here tonight to answer questions, provide information and recommendations. We want to welcome all of our viewers and listeners that are joining us tonight on Facebook Live social media, on the Zoom webinar, and tuning in on a whole suite of radio stations, which include 98.7 The Rock and Eagle, 97.7 The Wolf, 105.7 Eagle Country, and Q107 in Marquette. It's great to have you with us tonight. My name is Steve Elmer. I'll be serving as the moderator for the town hall tonight. My role is as a college professor and member of the Health Research Institute here at Michigan Tech University. In just a few minutes, I'll be joined by my colleague and co-host, Kelly Kam, who is an epidemiologist and also a member of the Health Research Institute here as well. So we're looking forward to the town hall tonight. It's important to just share a little bit about the goal of the town hall, which is to increase awareness about community and preventative health issues and how they impact you, your family, your friends, neighbors, and our Upper Peninsula community. It's also important to recognize our sponsors, which include both Michigan Tech University, their Health Research Institute, and Northern Michigan University, their Center for Rural Health. We also appreciate the ongoing support from UP Health System Portage, the Blue Cross Blue Shield Foundation of Michigan, and the Michigan Health Endowment Fund. We just want to let everyone know that tonight's recording is publicly available. It will be archived on our website and YouTube channel. That website is mtu.edu/health-research. Once you're on the page, you can click on Town Hall and pull up all of our Town Hall recordings. And then if you have any family or friends that missed the broadcast tonight, it will be re-aired this Sunday on ABC 10 at 12 p.m. Eastern. So with those announcements in mind, I want to welcome in Kelly Kam to tell us a little bit about who's here tonight and what should we expect as part of our topic and discussion on mental health and well-being. So Kelly, welcome.
Thanks, Steve. Glad to be here. So we have in the past, we have talked about mental health and had panelists on about mental health, but it's such an important topic that we felt that we really needed to address it beyond just the COVID part of it, and to really look at mental health and all the different things that are being done in our local areas to really help us with our mental health and well-being. So we have 4 different panelists tonight, and we are excited to have some more panelists and bringing in people from the Marquette area. So we have Christy Hechtman, who's a quality initiative coordinator at UP Healthcare Solutions, who will talk about how we can integrate behavioral health into our primary care practices and be able to integrate that all together. We have Greg Nien, the superintendent of the Marquette Alger Regional Educational Service Agency. If I have that all of that right. So as we've all experienced, certainly anybody who's parents out there, that the mental health of our kids is really critical. So Greg's going to be able to talk about our community mental health task force, specifically looking at youth wellness and some of the services that are available in our K-12 schools. And then looking at it from the university perspective, we have Abigail Weich, who's not only the head of the social work department at Northern Michigan University, but she is also the special advisor for campus well-being at Northern Michigan. So she's got 2 different roles to speak about, not only training the workforce for the next generation of our social workers, but also what's being done at Northern to help protect and improve the mental health and well-being of the students at Northern Michigan. And then we have a student, Meredith Rossio, who's an undergraduate student at Michigan Tech, who is among her academic pursuits is also a senior peer health ambassador at the Center for Mental Health and Wellbeing at Michigan Tech University. So she's going to be speaking about it from the perspective of a student and being able to be a peer advisor and peer ambassador for mental health and well-being at Michigan Tech. So excited to have quite a broad spectrum of people to speak on mental health in our region.
We are very excited to talk about mental health and well-being tonight. Kelly, thanks for that very thorough overview of who's with us here tonight. I just want to remind our listeners and viewers, if you do have questions, there's a couple different ways to send in questions. If you are watching tonight on the Zoom webinar, you can use the Q&A button at the bottom to send us your questions, and we'll direct those to the appropriate speakers. If you're on social media or listening on the radio and you want to email us a question, I'll give you our email address here. It's townhall2020 at mtu.edu. That was Town Hall 2020 at mtu.edu. And then Kelly, I did want to ask, I know about halfway through, our focus tonight, of course, is on mental health and well-being. And certainly we still are in the midst of the COVID-19 pandemic. And I think you have a little bit of a rapid fire or snapshot COVID update about halfway through. Is that correct?
Yeah, absolutely.
Great. Okay, well, we are ready to get started. We want to welcome in our first speaker, and that is Christy Heckman, who's with UP Healthcare Solutions, and she's a Quality Initiative Coordinator. So Christy, welcome to the UP Community Health Town Hall.
Thank you so much for having me, Steve and Kelly. I work for UP Healthcare Solutions. We are a nonprofit agency that is housed under the UPHP umbrella. We do a lot of grant writing and support for communities, and specifically look for regions of whether it be social determinants of health or insecurities across the Upper Peninsula, and ways in which we can support various communities. A big topic obviously is behavioral health integration. So back in 2019, we had written a grant for this project and was awarded through the HRSA government agency, a 3-year partnership to integrate these mental health services into primary care clinics. And so we partnered with Helen Newberry Joy and Schoolcraft Hospital, their rural health clinics. And we offered additional training for having a behavioral health care coordinator on site. So similar to chronic care management for diabetes, only it is in the mental health realm. So we were able to support them with additional training for that behavioral health care coordinator, with care planning, motivational interviewing, ways in which they can support those patients and further provide those services. In collaboration with this project, we were also doing a study with a panel of patients that had chronic health conditions. And it was shown over the 3 years of this project that those conditions improved just by having access to mental health services. So in addition to care management, you can also take it to the next level, which is collaborative care. The collaborative care model utilizes a consulting psychiatrist. And so the behavioral health care coordinator meets on a weekly basis with the psychiatrist, and they focus on the goals of the provider and the patient, and offer consulting services. So this is most often used for common mental health concerns or issues people may be experiencing. If for some reason they do have services needed above and beyond what can be provided in the clinic, they would be then referred out, but at least are receiving some level of care and care planning as well through that model. So yes, we found to be quite successful with this particular model. There's a learning curve for providers, whether it be medication prescribing and maintenance. And so we're having some really good success with that. So another program that we do offer to our primary care clinics is called an ECHO program. And for those of you that aren't familiar with the ECHO projects or programs, it's a telementoring series. So we utilize subject matter experts or psychiatrists in our realm of work to then train our primary care providers, clinicians, their support staff on how to recognize, diagnose, and treat various mental and behavioral health concerns. So our first series was integrating adult mental health, and we addressed depression, anxiety, trauma, and addiction in that particular series. Earlier this year, we did have a pediatric mental health series as well. That was 8 sessions, and we utilized University of Michigan psychiatrists and the MC3 program as well. We currently have a medication-assisted therapies program, so that's alleviating some of that apprehension that providers may have for treating substance use and opioid use disorders. And at this time, we're planning a trauma series to start probably in March of 2023 as well. So these programs are free to providers. They offer the opportunity for those in attendance to present cases that they otherwise wouldn't maybe know how to fully treat. And so they have that learning portion, and then there's the real world clinical examples so that they can take best practices back to the clinics and provide better health and service to the patients. As we know, because of the long wait list for many of our specialists, this is really the first line of assistance or care for many patients would be primary care. And another positive of that, it also relieves some of the burden of our specialists by being able to better manage some of the more common diagnoses. And a final component for our agency, we have multiple committees that serve to provide best practices for the clinics across the Upper Peninsula. So we have developed a behavioral health committee, and that has representatives from all across the Upper Peninsula. Greg is on our committee as well, and we are looking at not only across the health system, but whether it's inpatient, outpatient, adult, pediatric services, as well as substance use, treatment, acute and emergent care, and really looking at ways to better, I guess, combine services across counties and be able to better serve the patient population by giving access across the board, regardless of where you live or what insurance you have. So I know that's a lot of information. I'll let you ask a few questions. And
Great. Thank you, Christy, so much. Kelly and I will certainly help get the questions started here. And again, we welcome questions from our community members as well. Christy, you provided a very nice overview of all the programs that your agency is supporting. Could you talk a little bit more about the next steps as you implement a new program, evaluate to see if it's effective, and then talk a little bit about sustainability? Are these some of these pilot programs? How much information do you need before they're sustainable, for the long run or the long haul?
Absolutely. So any grant project that we coordinate or write does have a quality improvement aspect to it. So we are looking at, refining processes, looking for barriers and ways to get around those barriers and continue to improve on these processes. Sustainability typically looks like, for a clinic at least, how can they continue these services and bill for them, and make sure that it's a sustainable model for both helping patients, improving health outcome, and keeping the systems running as they need to as well financially. So most of our work is grant funded. And we look at collaborating with other agencies in the Upper Peninsula or Michigan as a whole to really leverage opportunities and funding to better really formulate some of these projects.
There was another question that came in here. You mentioned one of the programs, I believe it was the ECHO program that had the virtual or the telecomponent. The question here is getting at, is there a major difference that the provider and the patient sort of experiences, whether it's in person or through the video or something like tonight through Zoom, and is that something that you're evaluating kind of as you plan forward?
Optimally in-person meetings can be helpful, but I think that due to the distance across the Upper Peninsula and some of our rural areas, we wouldn't otherwise be able to join unless we were doing so virtually. So to know we already have, services lacking, At times, we do have to go out of the area to find those specialists to bring in some of the training. But we do work with, the universities locally, the health systems as well, and have brought in experts from U of M, Michigan State, and we really try to just work as a community, but still we want to stay ahead of the game and make sure we are truly serving our populations in the Upper Peninsula.
Great. Well, thank you, Christy. We're going to move on to our next speaker. If we have time a little bit later, we'll circle back to provide other questions to the entire panel. So we appreciate Christy. Next, we want to welcome in Greg Nian, who is superintendent of the Marquette Alger Regional Education Service Agency. So Greg, thanks for joining us tonight, and welcome to the town hall.
Thank you, Steve. Pleasure to be here. So I am the superintendent for Marquette Alger RESA. The RESA is an educational service agency, and we support 13 school districts in Marquette and Alger County, obviously. And that support comes in really a multitude of ways. One of our strategic plan priorities is currently set on student wellness. And over the course of the summer, as a means to promote that priority, we partnered with Marquette Area Public School District and started a community task force focused on wellness. That task force has met since the beginning of June. We meet every 90 days, and out of that effort has come a number of opportunities for our community to really pull together and shore up some additional mental health supports and systems for the youth in Marquette and Alger County. One of the exciting opportunities that was recently identified is the concept of a mental health navigator position. And this concept is really, the objective here is to provide a one-stop shop for people who are in need. So if you are a parent who is struggling with a child at home who is exhibiting behaviors that you're having a difficult time managing, the concept is that you would be able to call this resource, and they would be able to get you connected with a service provider that is already existing, and you would realize a seamless transition into a service. Really, the last thing that someone who is struggling with any sort of mental health need wants is to have to thumb through a list of phone numbers and try to engage in a number of phone conversations and determine whether or not this is the right resource. Or worse, they spend a lot of time doing that and only to learn that it's not the right resource, and then they have to start that process all over again. So again, that seamless access and integration into existing services. And we're hopeful that if this is a protocol that's going to be useful to our community, to our region, that we'll be eventually able to scale this up statewide. So very exciting endeavor there. Just one of many ideas and opportunities coming out of that wellness task force. In terms of other supports that we provide in our local school districts, many of those supports come by way of personnel. We currently have over 11 social workers that are out in our district supporting students and their needs. We also have 4 school psychologists that are employed by this agency. Marquette Area Public Schools has another 2 school psychologists provided there. We also provide a lot of professional development. So recently we engaged our school administrators in threat assessment training, and that was a nationally vetted protocol in which administrators go through a process to determine whether or not a student presents as a real threat in the school setting, or whether or not this is a student who is in crisis and in need of a different type of support. We also support schools, and we work collaboratively with community agencies in terms of crisis response. So in the event there is a crisis at a school, we have a team of individuals who will immediately mobilize and go to the location and provide on-site support for students, for staff, for parents, whatever that need is. We also provide a lot of professional development, obviously, as an educational service agency. And as Christy had mentioned earlier, we're excited to be partnering with U of M, and we're going to be piloting the Michigan Child Collaborative Care program, which is really a program that's designed to provide no-cost access to psychiatrists and clinical psychologists for those educational problem-solving teams that are trying to help students overcome various barriers to learning. So we've really got a lot going on in terms of wellness and supports to our region from Marquette Algerisa.
Thank you, Greg. I'm going to loop in my colleague Kelly Cam here. Kelly, I know there are some parents tuning in tonight, watching and listening, and there's a question from one parent to another about some of the warning signs. Could you maybe elaborate on that question that came in?
Sure. So I think certainly as not only in response to COVID, as many of our kids have been out of school or dealing with remote or all the stressors that have come with the pandemic, as well as what they were experiencing before that. As a parent, are there signs that we can look for that might indicate that our kids need some additional help or that we need to look out for? And does it really differ between our teenagers going to express something different? Mine are elementary age children. And so I, kind of thinking as they're growing, what should we be looking for as parents to help and reach out to the schools if we think that there might be a problem?
Yeah, that's a great question, Kelly. And I would say whenever you have a marked departure in behavior from what would be considered the norm by that parent, that's usually a pretty good indicator that there's maybe something going on and you should seek some outside assistance or check with your primary care provider. So in other words, if you have a child at home who has typically been outgoing and energetic, and all of a sudden or over a period of time they become more closed down, they stop communicating, their personality seems to have changed, or perhaps they seem withdrawn. Those are some real obvious indicators. I would say, sometimes too, if students exhibit anger that is typically uncharacteristic. Boys in particular can sometimes express themselves through anger, and that can be another indicator that there might be a need for some follow-up.
Just to piggyback, Kelly, go ahead.
I was going to say, I have a follow-up question on that. As I was preparing for tonight, I was very surprised at the number of the percentage of mental illnesses that actually that CDC was noting show up younger than 14 and certainly younger than 24. And I was curious as to what are the most common mental illnesses that we see among children that are showing up this early?
Yeah, I think with the pandemic, we certainly saw an increase in anxiety and anxiety-related diagnoses, somatic complaints, stomach aches, headaches, not wanting to engage in activities that they would have otherwise enjoyed or prior to that found enjoyment in. Depression certainly was at an increase during the pandemic when students were sequestered from their friends. Unfortunately, many students rely on K-12 settings for food that is sustainable and reliable. It's a safe place, And during the pandemic, some students, of course, were not in a safe place and didn't have access to food, and that was obviously those are certainly variables that will contribute to an increase in mental health needs.
One final question for Greg. Of the programs and resources that you described, where can parents or educators find more information about these? Perhaps on your website? And if so, what website can they go to?
Yes, so if you just go to marisa.org, our website has a lot of resources available to it. We also have Dr. Jen Shavina is our Director of Mental Health Services here at Marquette Alger Risa, and she can get people very quickly aligned to the resources that they need.
Okay. Great. Thank you to Greg. I just want to take a minute here and welcome any new viewers that might be joining us on the Zoom webinar or on Facebook Live social media. Any listeners that are tuning in, we're here for tonight's UP Community Health Town Hall. Our topic is focused on mental health and well-being. We have a panel of experts here tonight to provide information and answer questions that come up. Kelly, I wanted to turn it over to you for just a few minutes as we're about halfway through our discussion to give any COVID-19 related updates. As we've kind of weaved that in a little bit, our focus tonight is on broader mental health and well-being issues, but what should our community members be aware of on the COVID-19 front?
Sure. So as we've kind of shifted a bit, that we are certainly in a different space in the pandemic, but we will expect as we still don't have the high enough vaccination rates that we'd love, everybody should be out there getting a booster and get vaccinated if you're not already. We haven't seen an increase in cases, just it's kind of stabilizing right now. But as things get colder and people are more indoors and we are gathering for holidays, we do expect that there might be a bit of an increase. Deaths have gone down. So we have seen a drop in deaths, which is really good. We're never going to get rid of, in my opinion anyway, we're never going to get rid of this virus, but if we can control it, that's the aim. However, hospital admissions nationwide are going up. The other concerning part is that we are experiencing an earlier flu season than normal. And so also may be related to the pandemic in terms of everybody's now gathering. So as a society, we have a little bit less, potentially a little bit less immunity to the circulating strains. All of those things, any respiratory disease, covering your cough, any respiratory hygiene, covering your coughs and sneezes, staying home when you're sick, washing your hands, all work no matter what respiratory disease it is. But there is kind of this continued question as to what happens if we have an early and possibly a heavier flu outbreak or flu season than we've seen in the past, on top of that on COVID. And on top of that, we are seeing this, you may have seen in the news with RSV or respiratory syncytial virus. This is one that tends to be much more of a problem in younger kids. There are a lot of hospitalizations about this, and still trying to figure out what's going on with why we're seeing so many more hospitalizations from RSV. But all of those things together kind of always put us in the question of, we want to be around family. Absolutely, we want to gather. We want to have these important pieces of our life, but also do it in a healthy way. So just keep washing your hands, stay home if you're sick, test, so you know for sure, especially if you're going to be around susceptible people.
Great. Thank you, Kelly, for the COVID-19 update. We're going to continue our discussion here on mental health and well-being and kind of transition from K-12 or kids to now to college students. We're going to welcome in Abigail Weish, who is the department head in the social work department. She's also an associate professor at Northern Michigan University, and she is also the special advisor for campus well-being. So Abigail, welcome to the town hall, and we'll turn it over to you.
All right, thank you, and good evening, everyone. As both Steve and Kelly mentioned, I have been asked to be on the panel tonight to speak from two different roles that I serve at NMU. The first is one that I've been in for over 10 years as the department head for social work, and the second is my role as special advisor for campus well-being. I think the work that I've been doing, been able to do in both of those positions are ones that have have had an impact on UP residents and the health and well-being of UP residents. The first is probably more broader, reaching a larger number of UP residents. And that is through the work that I've done in the social work department. For those of you who don't know, the social work department at NMU has been running a Bachelor of Social Work program, fully accredited by the Council on Social Work Education since 1974. And we've been really successful in training those generalist social work practitioners, a number of which who have gone on to graduate and stick around the UP and start their careers, and are now actively serving people in need of mental health and health services and supports right here. However, one of the things we've noticed a long time ago in that tenure, since 1974, is that a number of our graduates determined that they needed to go on and seek to further their education and seek their Master of Social Work degrees. But because there was not an MSW program in this region of the state, many left the UP to attend graduate school elsewhere, and often didn't return to the community to practice with those additional qualifications. And for that reason, and prompted by the knowledge that the UP has been a critical shortage area for mental health practitioners for that workforce, and knowing that meant the mental health needs of UP residents were going unmet, we went ahead and started a new Master of Social Work program in 2019. And after a 3-year accreditation process, that program is now fully accredited, and we've graduated more than 40 students over the last 2 years. Those students are coming out with a more clinically specialized education and ready to provide therapeutic services to our community. So we're really excited about that and hoping we're making a small dent in that shortage of mental health professionals here in this region. In my second and new role, I'm having the opportunity to take that systems level approach to enhancing what we offer here at to promote student and employee mental health and well-being. So similar to what we aim to do with the MSW program, we are aiming to add capacity to our ranks here at NMU. We have a number of strong services to support the well-being of both of our students and our employees. But there's room to grow and enhance what we are doing to add to that, and to increase awareness generally about mental health needs of college students, and to increase the accessibility of those services that we have so that more students are connecting with those services that can help them in their times of need. So I'll just round down a few highlights of the accomplishments that we've made recently here on campus, along with a few insights into things that are coming for our NMU students. So back in the summer, we worked with a consultant who did a comprehensive assessment of our mental health services. And like I said, one of the things that came out of that is that we need to send a stronger message, a clearer message to our students about what is available to them to help them in their times of need. And so we spent a lot of time at the beginning of the semester promoting our counseling and consultation services. We also have a 24-hour hotline through Health Advocates that students can access and speak to a live person when they are dealing with a crisis. And then beyond that, we really wanted to get students involved in building that awareness. And so one of the accomplishments is that we've had a new Live at NMU group started, which is really a group-based suicide prevention group, and they are running the Live campaign that is coming out of the West End Suicide Prevention Group here in the West End of Marquette County. We had David Bartley, who is a national suicide and mental health advocate and very suicide survivor and mental health advocate, and a very compelling storyteller. He came here to campus back in October and spoke to over 300 students in different classes across campus. In October and November, 37 employees became newly certified in mental health first aid. which means that there are many more folks who are close points of contact with our students who now know how to respond when that student is displaying some distress, or know how to ask questions and have a conversation with folks to get that information to know whether or not they're in distress, and then help connect them to those resources, like I said, that we have in place. In terms of what's to come, one of the things that we are actively doing is searching for a new director of our counseling and consultation services. That's been a position that's been vacant for a little while now, in part because of the disruption of the pandemic. So we're very excited to bring that new person on board, which will add to our sort of capacity in terms of number of students that we can serve in the counseling office, but then also provide some leadership to that group. We are also getting ready to search for a new case management director. We're going to start a new service here at NMU, a case management team that will really be, like some of my colleagues here on the panel have talked about, integration and holistic services, comprehensive services. That's what the case management team is really designed to do, to connect all those dots and do some of that hand holding, like Greg mentioned. Folks may need to get connected to those referral sources and get those services started, versus just sort of being given a list of where they might seek help. We're also seeking to build our formal relationships and partnerships with other community providers, so that in crisis situations, we sort of have the capacity to respond to all those folks who might be impacted by a particular trauma that happens, and provide that supportive service.
Thank you, Abigail. We do have a couple of questions here. So just to get this started, I know you talked about those individuals who were trained in mental first aid. And the question here is related to some of the stigmas around mental health. And I'm wondering if you can elaborate a little bit and tell us more about how can we help better recognize or re-educate or reduce stigmas around mental health, or somebody is having an acute or chronic mental illness or condition.
Right. Yeah, I agree. Those are some really tough conversations. And one of the ways the best thing we can do is really just start talking about this, making this a normal part of our conversation, and acknowledging that, a lot of us are experiencing, symptoms of depression and anxiety because we've experienced this collective trauma of the pandemic. And so talking about it, normalizing it as much as we can. But then when we need to pay attention and notice those behaviors that are out of the norm for a particular person we know, and being willing to make that connection with that person and let them know that other folks are paying attention and caring about their health and well-being. And then that person being willing to sort of seize the awkward. There's a campaign out there that's about talking about suicide and mental health with folks, that you really just kind of have to decide to sit through that sort of feeling of awkwardness and just ask the questions and open the door to allow people to talk about how they're feeling.
And one more question here to kind of piggyback off of that. The question here is, when does a mental health maybe concern, something that's short-term, eventually become a mental health disorder? So sort of the analogy here is if somebody's having pain, and if it's going on for weeks and months and years, it's chronic. So I think that's what the individual's getting at here. Mental health concern, something that's acute, and when does it become truly chronic and truly an issue that is an impairment?
Right. And that's really a determination that's made on a case-by-case basis for somebody who's working with a mental health professional, right, who can gather that information about those circumstances and those symptoms, and help folks make that determination about whether there's a mental illness there and what kinds of longer term services might be needed in that case. And so that's an important point, is that when you're having those, it's very normal to have some of those short-term symptoms, and it's very appropriate to reach out and seek mental health support in those times, even when they are sort of seemingly less serious or not a crisis necessarily, because then you can have that ongoing conversation with somebody who can help you determine whether or not there's a need for a longer term treatment or a different kind of treatment.
Great. Thank you, Abigail. I just want to take a brief moment here and recognize our sponsors for the UP Community Health Town Hall. The Town Hall series is organized by both Northern Michigan University, their Center for Rural Health, and Michigan Tech University, their Health Research Institute. We also have additional support from UP Health System Portage, the Michigan Health Endowment Fund, and the Michigan Blue Cross Blue Shield Foundation. So thank you to all of our supporters. I'm going to turn it over to my colleague Kelly Cam and introduce our final speaker, who is right here at our home institution of Michigan Tech.
Yes, so we have Meredith Rossio, who's, as I mentioned, she's an undergraduate student herself. So she's got all the pressures of being a student herself, as well as being a student peer health ambassador, or I'm sorry, a senior peer health ambassador. Sorry, get all the names right. So I'm very interested to hear from the perspective of a different university and a little bit different perspective on how we can support the health of our students.
Yeah, thank you, Kelly. Like she said, my name is Meredith. I'm an undergraduate student. I'm actually majoring in supply chain and operations management, so I'm not directly associated with the psychology field, but I am minoring in psychology, which is my connection. I work for our Center for Student Mental Health and Wellbeing with a team of other wellbeing ambassadors, interns, and along with counselors from our center and wellbeing managers. My role at Tech includes everything from event planning to event coordination, content creation for our social media and our web pages online. I am just generally an advocate for students. I like to say that I love to chat. I love to hang out. I try to communicate that to everyone that I meet on campus. I give presentations on various topics, including stress reduction, alcohol and drug use, mindfulness, maybe work-life balance as well. It really depends on what our professors and our counselors and just the teams across campus who are taking care of students think that we need to bring to our population. At MTU, like many other STEM schools that are rural, we see students struggle with loneliness. We see them struggle with anxiety and depression. We also see, because of the high achieving nature of STEM schools, a lot of aversion to failure on the part of our students, also known as perfectionism. Being a rural school, we also see the seasonal affective disorder impact our students quite a bit as well. And for anyone who doesn't know what that is, it's basically a phenomenon that occurs when a person isn't necessarily getting as much sunlight exposure or just exposure to warmer weather in general, which affects their mood, and they might start to develop depressive symptoms or maybe a downturn in mood. And that's just something that often our students don't think of when they come to a rural school, and then on top of that are dealing with a rigorous education as well. So to mitigate all of that, we do a lot of stigma discussion. We promote the Green Bandana Project on our campus, which basically is when students wear a bandana on their backpack that is green, and it's a signal to other students to say that this person is a safe person. They are a touch point for you if you need resources. They will sit with you if you are in crisis and help you get to somebody who can help you. We also, for general well-being, promote our Be Well initiative, which was created by students. We asked them, how do you define your well-being? And they said that they define their well-being in 4 categories, which include live well, recharge well, connect well, and play well. And that's an initiative that's available online. We have all of our information about that on our center's website. And I think it's actually something that is applicable beyond just the student experience at Tech. It's a really good checkpoint for anyone, I think, to see maybe where am I not balancing these 4 categories of well-being well, where can I add in resources to my life or activities to my life to better balance my well-being? Maybe where can I remove some activities from my life in favor of bringing in other strategies in order to better maintain a more comprehensive and holistic well-being that's actually supporting you in the way that you need it to. I guess overall, because we do have such a high rate of students who struggle with perfectionism, and just maybe an inability to say that they need help. One of the most important issues that I always like to highlight is that of just, we spend a lot of time just trying to have conversations with students about mental health and well-being, where to get services, maybe what are your risks signs, what are your warning signs, and then what to do about that, because oftentimes people, they don't know how to access care, maybe they're worried about accessing care, and the fact is mental health, or at least I believe this, the mental health is just as important as your physical health, and you should be seeking care every year, just like you would a general doctor's appointment. And for students, that's especially important because when you are in this new environment, or maybe you're making friends with people that you didn't know before, and you're starting to interact in different ways with all kinds of different people, that really throws off maybe your sense of who you are or your sense of your own mental health. And so it's really important for our center just to have conversations and allow students the opportunity to know that what they are experiencing, it's not necessarily abnormal. There is help available, and we care about them very deeply.
Thank you so much, Meredith. We're going to start with a question here about recharging. I know a lot of students, whether they're K-12 students, college students, lifelong learners, hopefully will be able to recharge a little bit over the upcoming winter break. So first, could you provide us with that website, the Wellbeing Well, and then perhaps what are some tips or strategies that we might be able to recharge over the winter break once the end of the school semester is done?
Yeah, so if you would like to learn more about Be Well, you can go to our website. I believe it can be accessed just by typing in well-being at MTU. Otherwise, you can search specifically Be Well at MTU, and that should come up on your web browser. On there, there's different parts, so you can participate in Be Well as an organization. We partner with multiple different organizations, or you can just participate as a student or as a community member. There are printable resources on there. There's descriptions of the Be Well initiative. There's information on there on how to contact us if you want more information, or if you need support in maintaining your Be Well, I guess, exploration. As far as recharging over break goes, or just for anyone in the community, I really recommend things that get you moving, you're active. I really enjoy going to the gym. I was a swimmer in high school. I coached swimming for 2 years, so I spent time in the pool at Michigan Tech. And just in general, being outside, there's a lot of research to suggest that being outside can also elevate your mood and your mental health as well. Also, just spending time with family and friends in a meaningful way, maybe being unplugged from the work that you're doing, blocking out time to just step away from your desk or step away from the space that is requiring a lot of your energy at that time. That's also a really wonderful way, I think, to recharge a little bit. Other things, giving back to your community is a really great way to recharge. I think volunteering is always a great option. We try to recommend that to our students as much as possible. We have Make a Difference Day on campus every fall, so that's a great option as well. There's so many. I think I just encourage everyone to do a little bit of a deep dive into their own, into how they might recharge the best. So.
Thank you, Meredith. Now, we do have a few minutes left here in our UP Community Health Town Hall. Our topic is focused on mental health and well-being, to open it up really for questions for the entire panel. And I think we'll circle back to Christy and then maybe go to Greg and Abigail. The importance of collaboration in a rural area The UP, right, represents about 1/3 the size of our state, but only 3% of the population. So Christy, can you just sort of reinforce the notion of the importance of working sort of not in silos, but working collaboratively, whether it's with the healthcare systems, the K-12 schools, the universities, and maybe what can we do to improve or to have more robust collaborations to help us address some of the health needs for the UP?
Absolutely. I mean, our communities are close knit. So those of you that know someone with mental health, they also have family members or coworkers, or we've all experienced it one way or another, or know someone who has. So I think now more than ever, I'm seeing this collaborative unity with our agencies, and just to focus more on those barriers so that it is equal access for all, regardless of, where you live, your income level, your insurance. Just make sure you're reaching out to someone for resources. But like you mentioned, in the past, it seemed a lot more siloed, and I've never seen such community since, the height of the pandemic. Perhaps it's the stigmas are coming down and the support is there. So please reach out to someone if you need help.
Great. Thanks, Christy. Greg or Abigail, anything that you can add?
I would just say, I think it's really important when we're talking about the concept of well-being that we are thinking holistically, that it's your physical health, your mental health, your experiences in your community and society are all really integral to creating overall well-being. And so, we may operate sort of in these different areas of well-being as professionals, but we can't touch it all, right? And there's expertise across the board of those dimensions. And so the only really way that we can create well-being, improve well-being, is by being connected with all of those different folks who are sort of experts in those areas. And so, and the other thing is, when we talk specifically about mental health, one of the biggest risk factors that lead to crisis is isolation. And so the antidote to isolation is connection. So as much as we can do to connect with each other is very important. And to that end, I've been participating in the Youth Wellness Task Force that Greg mentioned as well, because it's important that NMU sort of understand that the well-being of our students, because our youth in our community, many of whom become our NMU students, and then they, graduate and continue to be residents here. So it's very important for an institution like NMU to be closely connected with its community partners.
I would echo Abigail's comments, and I would just add that, rural Michigan and the entire Upper Peninsula meets the definition of rural. It just has fewer resources than our urban and suburban colleagues in downstate. So collaboration is critical. It's going to sound cliche, but we truly are stronger together, and we need to work collaboratively and collectively to support one another.
We have another question here that came in. I'm going to direct this one to Abigail, talking about the relationship between mental and physical health. So if somebody has a mental health condition, does that increase their risk for maybe other physical conditions that we might be a bit more familiar with, for example, heart disease or high blood pressure or other things?
Those things are definitely connected. And sometimes the source sort of is yet to be determined where it comes from, which starts first. But definitely there can be a lot of somatic symptoms. I think somebody mentioned that earlier, when you're experiencing a mental health problem that you're experiencing in your body. And that can have short-term sort of can display in a short-term kind of way, but it can also sort of manifest in a long-term kind of way in your body and affect that physical health.
Great. The next question is for Meredith. Meredith, if students are interested in assisting in becoming a peer health ambassador, how do they get involved?
That's a great question. The first thing that I would do is get in touch with our center. You can email us at wellbeing@mtu.edu and just inquire. I can't necessarily tell you when a position will be open. I think everything is filled right now, but I do know that we always love having students who are interested in mental health and well-being, and we will reach out for you for help, maybe on events at any point if we know that you're interested. We also do work closely with the Wellbeing Advocates, which is a club on our campus, and you can join them through the MTU involvement link. They do one event partnered with our center every semester, and then sometimes more than that, depending on the capacity that they can take on at this time. I know that they're always looking for members, and we'll work with them closely depending on what they require of us. So that would be my first recommendation for that.
Great. Excellent. Excellent. Thank you, Meredith. We're just about out of time here, so I'd like to go around the Hollywood squares. If you're watching on Zoom, if you're listening, we're going to do a little rapid fire takeaway from each of our speakers. So Greg, we'll start with you. If you could just give us maybe 20 or 30 seconds of a key takeaway that you'd like our listeners and viewers to leave with tonight. I'm sorry, I'll start with Greg and then go to Christy, slightly out of order, but go ahead, Greg.
Sure. I think one of the key takeaways from my point of view is there are a number of different institutions that are represented here tonight, and we all have a common goal, and that's to increase wellness in our region. And it's really regardless of age or the age group that we represent, wellness and physical well-being are definitely connected, and it's such an important goal, no matter who it is that we represent.
Great. Thank you, Greg. Go ahead, Christy.
Thank you. Yes, Greg said that quite well. We are looking for ways to collaborate and improve resources in the Upper Peninsula. This is an ongoing project for all agencies, and I'm really impressed at the programs that are out there and available. So if you are struggling, don't hesitate to reach out to your providers, your health centers, and it's great to see Meredith too on board with some younger points of view, because we know that's a struggle at all age groups. So thank you.
Absolutely. Thank you, Christy. We'll go to Abigail and then I'll wrap up with Meredith.
I think a strong takeaway that I hope people go home with is just a sense of hope, right? That good work is being done, and that one of the ways to feel hopeful and become a part, to feel empowered, is to become a part of this sort of movement that we're talking about here, of collaboration and paying a lot of attention to holistic well-being across the UP. So take away a sense of hope and take away a motivation to be a part of things that are happening.
Thank you, Abigail. Meredith, go ahead.
Yeah, I guess I don't have a ton to add, but just going off of what Christy, Greg, and Abigail have already talked about, I would just say investing in yourself and your own health and well-being is so important, but also investing in other people, having intentional conversations about how other people are doing, how you are doing, and just making sure that you're actually spending time getting to being able to understand maybe what other people are going through, and just knowing all of those different perspectives as far as mental health goes. That's so important.
Great. And I'll turn it over to Kelly for the final 20-second takeaway. Kelly, what do you have?
I would just say that I think it's great that not only is this becoming a conversation locally to be able to improve our community's mental health and well-being, but it's also a national conversation. And so there's opportunities to be involved locally, nationally, And also to be able to reach out, I just want to let everybody know 988 is a new national hotline. So it's a suicide and crisis prevention hotline. You can call 988, similar to the 911 system. You can also text 988, or you can chat online at 988lifeline.org/chat. So if there's not resources where you are right now, you can always call, and somebody will be there to answer the phone.
I want to thank all of our presenters one last time. Thank you for our listeners and viewers that were tuning in. We appreciate all the support from our sponsors, including Northern Michigan University, Michigan Tech University, UP Health System, Portage, the Michigan Health Endowment Fund, and the Blue Cross Blue Shield Foundation of Michigan. Really enjoyed the discussion and meeting everybody tonight. Our focus was on mental health and well-being. Have a great rest of your evening. Happy holidays, and we will see you at our next town hall in 2023.